Hi, everyone. My name is John Faulkner. I'm your host of the Smarter Systems, Better Care podcast. I'm here today with Dr. Javaid. She is the founder and CMO of HerMD, trailblazing physician and thought leader redefining women's healthcare and access. Thank you for joining us today.
Thank you for having me.
Absolutely. And just to give our listeners context, tell us a bit about your background and how you got to be where you are today.
It's such a long story. I was meeting with a bunch of founders the other day because I love to mentor, and they're like, "You're one of the OGs." And I was like, "Now you guys sound like my teenagers." I am a 2-decade board-certified ObGyn, went into women's healthcare because my mother nearly died at the age of 45. She had been complaining of left arm pain, shortness of breath, and chest pain. And due to lack of data that still exists today, lack of clinical trials in women, just lack of really listening to women, my mother's symptoms were blamed on too much caffeine and stress of her children. She underwent quadruple bypass surgery. We were told if the heart attack would have come, she would not have survived. I was pre-med at Northwestern at the time. And really, that was people talk about a wake-up call. That was my calling to go into women's healthcare. And fast forward through medical school and residency, and I felt like an absolute failure. I was struggling at home and trying to be a good mom to my one child at the time, and was feeling like I was failing patients, like I was practicing doorknob medicine, and the nurses would knock on the door and say, 8 on deck. And I'm just trying to get into the story and listen to women. And so when the personal timing and the professional timing is right, I quit my job, bought a building, and started a practice that I really thought was just going to be a really nice place for the women of Cincinnati to come talk about some specialty issues, and where providers could truly practice medicine with longer appointment times in just a beautiful space.
Excellent. It sounds like you got like a true personal story, connected to what you're doing today at HerMD. So, and what's kind of like the core focus right now of your business today, and like how do you serve your patients, your clients?
Oh God, we've pivoted so much. So the first location was opened over 10 years ago in Cincinnati, Ohio. I bootstrapped a second location with 2 other founders, and then we went into fundraising because we decided, after watching women come from 35 states and 3 countries, that this was before the menopause gold rush and people were into sexual health care. We were an insurance-based system that was performing advanced gynecology, menopause, and sexual health care in a tier 2 market, right? A care desert. And so we decided to go into fundraising. And as minority women, because we were 3 minority founders, we were told that we had less than 0.5% chance of raising NAVC funds. We actually ended up oversubscribed and raised $10 million in just under 6 weeks.
Wow, that's amazing. Yeah.
In total, we've raised just under 40. That allowed us to expand access both virtually and to 5 locations. Unfortunately, earlier this year, due to a multitude of factors, which we can get into, we had to pivot from the original model, which was integrated brick and mortar and virtual, and really just double down on how can we do this with the most capital efficiency and with the speed that we need to, but with still preserving our evidence-based outcomes. And that was to truly just double down on the virtual care access. Because currently right now, there's 1 trained doctor in menopause for roughly every 32,000 patients. And for that reason, and you can't build buildings quick enough to keep up with the demand. We were accruing wait lists of over 1,000 patients before we even announced who the providers were going to be in the locations. So, yeah.
Oh, that's amazing growth and data behind that. So it sounds like it's been like wildly successful, despite the comments that may have been made early on. So that just speaks to a testament of like how persistent and dedicated you are to your business and your company.
I think when you're mission driven, and so patient and provider focused, every time I wanted to quit as a founder, and if any founder tells you that there weren't days where they wanted to quit,
Yeah.
I literally remember sitting at a breast cancer dinner and I was like, I think I'm done. Like, I think I'm just ready to throw in the towel. This is too hard. It was one of our rounds of fundraising. And I went to the bathroom and a woman I did not know grabbed my arm and she's like, oh my God, you saved my life. And I was like, what? She's like, you're HerMD. And I said, yes, we both are, because my co-founder was standing next to me. And she's like, you don't understand, you found my breast cancer early and everyone else dismissed me. And I'm here today because of HerMD. And literally walked out, looked at my co-founder, who's also my sister, because we both nearly lost. And I go, I guess we're not quitting. And so every time I wanted to quit or throw in the towel, it's like the universe gave me a little nudge that
Yeah.
kept me going. Yeah.
That's an amazing story. It seems like for many people, I hear that as well, as like you want to give up, or such a roller coaster with startups. Unfortunately, you got to keep
I mean, my
going.
husband's a medical oncologist, and there are days where he comes home and he says to me, stage 4 cancer is more predictable than your life as an entrepreneur. And he's like, I don't know how you made that jump from being a surgeon and an OBGYN, because you're really good at what you do. And then all of a sudden I jumped off a cliff and became a business owner and a founder and an entrepreneur. And that's what I want to tell other founders and other physicians, is that you can be an innovator, you can be a founder, you belong in those rooms. In fact, healthcare companies and decisions and innovations can't be informed without you, because we see the problems, we can figure it out, and we know how to uptake and operationalize new innovation. And so without us, new innovation dies. And so I encourage founders, particularly physician founders, medical care providers. I'm like, your insights are key to innovation and to moving the needle forward.
Absolutely. Thank you for giving us a background to kind of how you grew, and like from the start. It's just an amazing story, and I appreciate you taking the time to do that. And when you look at your role, where do you spend the most energy today kind of driving the growth?
So as a true founder, I kind of just follow, well, number one, I'm an innovator. So I'm always the one who's identifying what pharma, what devices, what partners we are going to work with. Because for me, I'm trying to close the gap of, we had physical locations, we don't. I want to deliver end-to-end care as much as I can virtually. It's hard for a former surgeon for me to think like that, but I love it because it uses that founder entrepreneurial part of my brain. Innovation is where I spend a lot of my time. Research. The reason we stand out amongst our competitors, even though we're smaller, is we from day one pull data and outcomes, because I knew, even with insurance companies, everyone said, well, there's no data. There's not enough data. There's not enough data. And did we do double-blinded, randomized, controlled clinical trials? No, those cost millions of dollars. I spent the millions to build out clinics and to hire providers and to provide care. But we did collect data on our outcomes, and we had them peer reviewed, and we presented them at conferences like ASCO and Menopause Society and ISHWISH. So research, data, innovation. I still see patients because that is where I identify problems, where I can help with operations and insight, and honestly, where I still get ideas and I know what's going on at the pulse of patients and where are their problems still. And so that's where I spend the majority of my time. And then I would say the last huge bucket to me is education. I mentioned that huge gap that exists. And so we created a training program at HerMD called HerMD Academy that we used internally to train all of our providers and also to preserve our metrics and our outcomes. And so I spend a lot of time training providers as well.
Excellent. Well, it sounds like you have several different pillars going on, and you're constantly thinking about things, new innovative ways to accomplish things in the market. So,
I'm a mother. I know how to multitask.
yeah.
Yes.
Yeah. I can definitely tell. I can tell you're very passionate about what you do, and that drives your growth, and I'm sure comes out with your clients and patients that you work with. And just looking like high level, kind of stepping back, like at the industry, like what's one shift in your industry that most leaders are not paying enough attention to?
I still think that women are invisible patients. I still think that we are not giving female founders, even though we are more capital efficient and we have outsized returns. So there's not enough funding in research so that we can have the data.
Yeah.
And there is not enough female leadership, even though we outnumber men in the workforce. I hate to say this because, people are like, oh, you're a man hater. No, I'm not. I've been married 29 years. I have a son. It's not about that. It's, I want gender equality. It's not that I don't want things for male patients or male providers, but The truth of the matter is when you look at outcomes for patients, female providers have better outcomes compared to their male providers, and yet we don't survive in the workforce. And it's because the workforce doesn't heal our healers and doesn't support us through motherhood. I was told you got to pick. You can be a mom or you can be a doctor, but you can't do both. The irony is I later saw that proctor in an infertility clinic. I'd never walked up to her and talked, but how vulnerable she had made me feel in that moment. But I think we're still overlooking female investment, research. And the third thing I would say is reimbursement. I don't know if you know this, but if you take equivocal male and female procedures, we are still reimbursing 3-to-1.
Wow.
And so what you're doing is incentivizing providers who can take care, like a urologist, for example, like an OBGYN, right? We take care of female patients or those who identify as female. But a urologist can take care of both. But if you look at their patient population, a lot of them are skewed 80-20 male, female. Well, if you look at reimbursements, sometimes they're 3-to-1. And anyone who has to pay the bills, pay their overhead, pay back their med school
A huge
loans,
difference. Yeah.
would not fault them for doing that. You've got to pay the bills. So I would say reimbursement is the third big bucket. And I don't know if you've been following the story about Dr. Potter, but that surgeon who spoke up against insurance companies is now being penalized and not being placed in network. But insurance companies are infringing on medical practice, particularly when it comes to female patients. I've had hormones turned down. I've had surgeries turned down. So it's a big, big uphill battle.
Yeah, absolutely. And then like if people are not adapting to this, or like how have you adapted to like these massive changes within HerMD? I'm just kind of curious, like what's been your approach?
So I fought the good fight for a decade, and it took me a lot to say, okay, feather in the cap, because I swore I would never go outside the insurance system, because for me, accessibility was so core to who I am as a human being. It's why I became a doctor, to heal people and to make sure that care was accessible. But I finally gave up because insurance companies just don't play fair. And even though my providers were superbly trained and we showed them our outcomes were superior, if you happen to be employed down the road by a hospital system that had a lot more bargaining power, even if you were not trained in menopause or sexual health care, even though you didn't have outcomes, even though you didn't have 5-star aggregate reviews, you would get paid 5 times as much as a HerMD provider. And so I fought the good fight. I would meet with the CMOs. I would get on social media. I would beg them for meetings. I had slide decks. I had outcomes. And I finally gave up. And I said, and I don't know if giving up is the right word, as to turned my attention to other things that I had more control over. And I had to pivot again. And I think that's what entrepreneurship is a continual pivot. And I said, how can I continue to still be accessible, but play outside the insurance-based system? And what we did was pivot to a cash-based system, but within an EHR that allows us to print super bills and allows patients to then submit them themselves. And so kind of put some of the responsibility on the patient. And I wouldn't even say that, I'd say partnership. Like, we will take care of you and we will keep it not concierge pricing, but very accessible pricing. But you need to go take this with the insurance company, because we can't keep the lights on if we have to keep fighting with the insurance companies.
Yeah. It's a battle I keep hearing, unfortunately, with all of my guests, is working with the payers is very difficult and not conducive relationship, and is very difficult to manage, unfortunately.
I think one of the easiest fixes, so they do have transparency now, which is nice, but if they could just offer national contracts, it would give founders such visibility into, I could make a New York clinic work, I could make a New Jersey clinic work. Obviously, your capital costs, your build out costs, your labor costs, your average pay is going to be different. And that's also very open knowledge. But then you can decide geographically where you can afford to open physical locations and where you can penetrate an area virtually instead. But because, there aren't a lot of national contracts available, that is also a huge limitation for women's healthcare companies, because you just don't know what you're going to get until you start negotiating with the insurance companies. And a lot of them can tell you, hey, our network is full. And it wasn't until I would say, okay, but only 2 of your gynecologists in the entire state are trained in these areas. So are you really servicing the needs of the entire state of Tennessee? But it takes time, and even getting that person. And it was like through a friend of a friend who had golfed with someone. And that's how I mean, that's
Yeah.
honest to God
Yeah.
truth. They're like, how did you get their attention? In another state, it was a social media campaign, and it was not hate, because you don't want to get the wrath of an insurance company, but it was like, won't you please help me help the women of X state, And within 2 days they responded, and they were like, can you please tell Dr. Javaid to say nice things now on social media? And I was like, well, I didn't think that was mean. I was just asking you for help. So you just have to be really, really innovative when you are trying to work with insurance companies. And it shouldn't be that way.
Yeah, of course. It should not be that way at all. And like, what's working really well with HerMD that you would never want to lose today?
I would say our patient experience. Across 115,000 patient encounters, we have aggregate reviews of I'd say almost 4.9. And so do we always get it right? No, I don't think anyone does. Do we strive to get it right? Yes. Am I the founder that will read 25 amazing reviews and then see one negative review and I'll fixate on the negative? Of course, that's the surgeon, that's the doctor and me. So we wake up every day with the best intentions. But I would say that, I saw patients all day today, and they were crying from happiness, from relief, from finally being heard and seen. And so I think by creating a safe environment where physicians are trained and providers are trained, we got that really right.
Yeah, that's amazing. And then the 180, the opposite end, what's been harder than expected despite all the effort you put into it? Like, what's been very frustrating?
I think fundraising in general is frustrating, even though, and people would be shocked because I've taken global stages talking about, raising nearly $40 million as a minority woman, now 50 years old. It's pretty rare. But fundraising always takes longer than you anticipate. It's always interesting when you bring more and more investors around the table, because you're trying to prioritize patient outcomes and providers. And I call it the triangle of the P's. So there's profitability, patient outcomes, and providers. And the 3 P's don't always play nicely. And so in healthcare, it's sometimes hard to always talk about profitability when you're trying to make sure that it doesn't negatively impact, patient outcomes or provider experience or their ability to practice medicine. And so it's always interesting. And as a founder, I think you have these ideas. It's almost like giving birth to a baby, and what vision is going to be like. And then where it ends up is not always where you thought it was going to be. And that's not always a bad thing, because you're constantly learning and pivoting. But I would say having to give up the physical locations was one of the hardest things I've ever had to do. I said I'm a surgeon at heart, so not being able to do biopsies and operate and do ultrasounds on site was very hard for me. And I truly believe in an integrated model, so that patients that do have that choice to come in and have the accessibility to those services if they need. I think in the future we'll obtain that through partnerships, either with hospital systems or other people on the ground who, have that capability. And I think just recognizing that you can do things really, really well, but you can't do all things really, really well. So learning what to let go of and recognizing where the gaps truly are, and then filling those gaps and letting other people, take care of patients in the other manner and let them do that well.
Absolutely. And then if you solved all these bottlenecks, all these barriers that you're dealing with, unfortunately, what would success look like for HerMD in 6 to 12 months? What's the vision? Where do you want to go?
Success to me could mean so many different things. It could be, getting into all 50 states and growing the telehealth model to that. It could be merging with a larger partner who already has all of that kind of operational support in play. And then we could just double down with our training and our providers and the patients that we have. And then, like I said, obtaining those partnerships. And then for me, really expanding the educational platform is a huge, huge priority, and such a gap for providers that I would want to fix that. And so, I talk to my kids a lot about legacy, because I have a 24-year-old son who's first year out in the workforce. I have a sophomore at Ohio State, and then I have a junior who's pre-med, but she's in high school. And they always talk to me about legacy. And I say, you guys, being a mom is still the most important thing in the world to me. But I just, I used to talk about revolutionizing the healthcare system. And I just want to know that the healthcare system is a little bit better than where I found it, because I found it in a complete mess and it nearly killed my mother. And I want to know that I have trained the next generation of providers so that they're not graduating as lost as I was when it came to menopause, where women will spend 40% of their lives. And so if I can train the next generation, and then they'll train the next generation, and I can make the impact across, over 100,000 patient encounters, then I've done my job. I've done my job.
Yeah, and you've certainly been doing that, exponentially. So you're well on your way to doing that, building that legacy that you're seeking. And, where can people connect with you if they want to chat more about HerMD or in the wonderful work that you guys are doing?
Yeah, so HerMD is on Instagram. Somi Javaid, MD. I have my own Instagram as well. You can go to hermd.com, learn all about us. drsomi.com, you'll find out about my speaking engagements, all of our latest research and links to our posters. But we're pretty active. And then my own podcast called The Disruptor. We'll soon be launching season 2, but we are still dropping episodes from season 1. And I have a lot of fun with founders and people in the space who are really innovating and trying to shake up the women's healthcare system.
Excellent. Well, thank you for your time today. It's been a wonderful discussion, and thank you again. And hopefully we can connect more.
Great. Thank you so much for having me.
Absolutely.